Hello viewers and friends. In the previous video we had discussed about the basics of cancer, how it is presented, how the diagnosis is faced, and what are the conventional treatment methods that are available, that are necessary rather for cancer management. To continue with that, we have, like we had discussed, we have chemotherapy, we have surgery, we have radiotherapy, we have targeted therapies, hormone therapies. So we have various treatment modalities based on the type of cancer, based on the site of cancer and what stage the cancer is. The treatments will vary. So how alternative systems of medicine, or rather complementary systems of medicine, will aid the outcome of cancer treatments, will improve the quality of life during cancer therapy and post-cancer therapy, is what we're going to understand today. So a lot of questions are there. The first question that most of the patients ask is, can we do only complementary systems of medicine and not take chemotherapy and radiotherapy because they have a lot of side effects? That is not a healthy approach, is what we opine. We always tell our patients that it is ideal to do complementary and alternative systems along with the conventional systems for better outcome. Okay, so never go against allopathic systems of medicines and say they have side effects and so many complications are there and we don't want to do it. They are very much necessary, and at that point of time side effects are okay when you compare to the risk of not taking the treatments at all. Side effects can be effectively managed, so conventional treatments are important. So there are different stages. Pre-diagnosis, we have discussed, we have to prevent cancer. We have understood the causes and we have to prevent it. Once the diagnosis is made and when the treatments begin, complementary and alternative systems help in improving the mindset, or basically managing the stress levels of the patient. So when we start doing yoga practices at that point of time, it will help you calm down the mind. Most of the times, again, when it comes to yoga, a lot of people think, I'm going through cancer, what yoga can I do? But yoga is not always yoga asanas and difficult postures. Yoga has gotten to do with a lot of other techniques. There are breathing exercises, there are pranayamas, there are relaxation techniques, there are guided imagery relaxation techniques, there is meditation. All of these will help you boost your mental energy and your willpower. So yoga is going to help during the treatment phase to improve your mind set. So it will help you manage your anxiety, it will improve the quality of sleep. And at the same time, when patients are going through chemotherapy, there are a lot of nausea, there's vomiting, there's hyperacidity, there's neuropathy. All of these symptoms can also be managed with yoga therapy. Once the treatment is done and during the chemotherapy, yoga is going to help in managing the side effects, improve the quality of life. Post surgery, after surgery, immediately breathing exercises and pranayamas are going to heal the surgical site better, and after 3 months doing practices will improve the functionality of the site that is being operated on. For example, if a patient is going through breast cancer and if the site is operated, patients will also have shoulder stiffness, chest tightness, and all the lymph edema that causes swelling in the hands. So when yoga is practiced at that point of time, all of these symptoms can be well managed with yoga. Okay, After the treatment is done, or once the treatment is done, and when you are going through radiotherapy, or if you are going through other targeted or hormonal therapies, again yoga therapy is going to help improve the treatment outcome and also manage major side effects like ulcers that come in the mouth, lot of tiredness and mental lethargy and physical fatigueness can be taken care with yoga practices. Post treatment, for rehabilitation and maintenance of the effect of the treatment, that means to prevent the further metastasis of the cancer, or again if the cancer is spreading in some site or increasing in size, if you have to prevent that post treatment, yoga practice is going to help with the secondary prevention. One beautiful thing about yoga practice is when you're practicing yoga, you improve your breathing capacity. So you're oxygenating yourselves better, and scientifically less oxygen in the tissue, which is called tissue hypoxia, is a major indicator for metastasis. If there is tissue hypoxia, cancer cells start to spread. They multiply, they spread to different places. So when you practice yoga, you improve the oxygenation of the cells, and thereby you are directly targeting the cancer cells. So cancer metastasis is prevented with yoga practice. Coming to acupuncture therapy. Acupuncture is going to help in all of these stages, that is pre-treatment for pre-diagnosis for prevention, during the treatment to enhance the outcome, post cancer treatment for rehabilitation. Okay, so acupuncture is going to improve the blood circulation, improve the energy circulation in the meridians, so that way it will help in majorly, it will help in neuropathy that is seen during chemotherapy. And during chemotherapy, a lot of patients also have hyperacidity, constipation, nausea, vomiting. These symptoms can also be taken care with acupuncture therapy. Next, when we get into the aspect of mind, acupuncture is also very helpful in relaxing your mind. During the session itself, those 30 minutes only, you are very much relaxed, and following that also the effect of the treatment is there, where you feel mentally relaxed. Physical fatigue is also taken care. And post the treatment, when you are in the state of rehabilitation, acupuncture is going to help in improving the outcomes that have gotten with your conventional treatments. We have understood that cancer is an inflammatory disease. There is high grade inflammation that is happening in the cancer site, low grade inflammation happening throughout the body. So it is proven beyond doubt that acupuncture is going to bring down the inflammation big time, even the high grade inflammation as well as the low grade inflammation. You need not have to worry that when acupuncture is taken, it will spread the cancer, it will increase the size of the cancer and all that. We as professional doctors, we know which side to use the needles. When there is an active cancer site, we don't needle the area directly. We have other points that will help during the cancer care, and we are going to use only that. And that is why it's very important that you go to a licensed acupuncturist and not some quacks who are practicing acupuncture. So acupuncture is also going to help in all the phases of treatment in improving, one, the outcome of the treatment, manage many side effects like we have discussed, the ulcers, the nausea, the constipation, neuropathy. All of these can be taken care with acupuncture therapy. To conclude, many a times cancer also ends with spiritual distress in patients. Patients go through a lot of, there's questions that they cannot answer and they want to. There are a lot of things that are unanswered for them. So when spiritual distress is going on, practicing yoga, taking acupuncture, counseling will help in management of spiritual distress as well. So these complementary and alternative therapies are not only going to help with treatment outcomes, but also it is going to manage a lot of side effects. With that, I end today's discussion. Thank you.